Hello, 402 class and Professor Lopez. Thank you guys for tuning in to my disease and disability presentation. My specific topic is going to be covering fifth disease. Um, and let's go ahead and jump right into it today. So, what is fifth disease? Fifth disease is most notably characterized by a bright red rash that appears on the cheeks of children, typically ages 5 to 15. This disease is caused by parvovirus B19, and it is in fact highly contagious. So, something to keep in mind as we move forward. Let's go over quickly some of the symptoms associated with the disease. Um, Primarily at the onset, we're going to take note of fatigue, achiness, low grade fever, runny nose, and sore throat. So typically, this infection will go in three main stages. The first of which, as listed here, are going to be mild flu like symptoms. The second is going to be the sort of hallmark of fifth disease, which is the bright red skin rash that occurs on the cheeks. And lastly, you may see some latent rash that appears on the arms, trunk, and face as well, which appears sort of lacy as you move to the latter stages of the infection. So it's something to bear in mind. Treatment for this thing. Right now, there's no vaccine. Immunity is often developed after the first infection, meaning it's sort of a one-time deal, similar to something like chickenpox, where once you have incurred the infection, your body will develop an immunity to it, and you're at very, very low risk um, of ever contracting the infection again. Main things to consider when treating this, being that it is highly infectious, you want to isolate from peers as much as possible. That being said, the early onset is associated with flu-like symptoms, which can often be confused for a number of things. So, if a healthcare provider is able to diagnose this and identify it early, it's something that you definitely want to stay home from school, just because of the highly infectious nature of it. Now, the infection spreads through respiratory droplets, which are typically spread through coughing, sneezing, talking, um, things that kids can often have trouble learning how to do appropriately and can have issues with. So, in terms of prevention, there's not a vaccine at this time, just because it's not ultimately that severe of an infection. The best way to prevent this is through practicing good hygiene and developing good hygiene habits at school, especially for those young kiddos. I think it's important to try to hammer home some of those concepts very early. Washing your hands frequently and thoroughly, coughing and sneezing into the crook of the elbow, avoiding close contact with an infected person. As I mentioned, that can be a little bit easier said than done, but trying your best to be observant and vigilant of some of these symptoms as they arise. If diagnosed, rest at home until the flu-like symptoms subside. An important thing to take note of here, as you kind of understand the different phases of this illness, once the rash has appeared, which characterizes the disease and which fifth is most closely associated with, the actual skin rash itself is not contagious. So it's not like some of the other skin rashes or different things where you'll have the spread through skin contact. The infection is spread specifically through respiratory droplets, so you don't have to worry about too much once that rash has presented itself, as long as the student isn't experiencing severe symptoms that keep them, in any degree physically incapacitated. Then you don't have much to worry about that after that as an educator, which is good to know. Um, as I mentioned, we'll see here on the right this sort of lacy rash that can appear towards the end, the tail end of the infection, something to take note of. As I mentioned, the rash itself is not contagious, and symptoms will typically last for around 10 days. In very rare cases, they can extend for up to several weeks, the rash that is. Um, and about 10% of children also experience joint pain and swelling alongside this. Once again, that's where that acetaminophen will come in handy as a treatment. Risks in adults are fairly limited. As I mentioned, if you were infected as a child, it's very, very unlikely that you'll experience any sort of difficulty with this. But one thing to keep in mind as an educator is those immunocompromised groups or students who may have like a severe blood condition or afflicted by one of these many illnesses that you see below. These high risk students may experience more severe complications tied to the infection. So it's something to bear in mind if you have students who have a well known or documented history of blood transfusions or HIV. Um, just to keep in mind and take extra precautions, which oftentimes I imagine you already are in those cases. It can cause complications in pregnancy, specifically if the mother didn't incur the infection as a child, which is another thing to keep in mind. So, takeaways here ultimately, this illness, while it can be impactful to a classroom, particularly an early childhood classroom, it doesn't present any long term risks and is relatively mild in terms of the symptoms and the severity of the symptoms. So, in terms of long term planning or restructuring of a classroom environment or curriculum around these lines, there really isn't much to do here. It's just one of those things that if it is coming through, to try to use resources available to you, school nurses, communication with parents, family doctors, just to try to get out in front of it as best you can. But like I said, once the rash has sort of shown up, and it is clear, luckily the student is no longer contagious at that point. So, um, as I mentioned, it is contagious, but ultimately, very rarely does it turn into anything that's more severe than maybe like a light cold or flu. Um, Alrighty, well, thank you all for listening. I hope this was of some utility to you moving forward, and hopefully there was something in there that you could take with you as you continue on your journey in education. All right, thank you.